All right. Hello, hello. Thank you for tuning into another episode of Take Care with Blair. And we've had some amazing guests on the show thus far, and today is no exception. Jacob Holden, local Montana broker, is joining us. Jacob, welcome to the pod.
Hey Blair, happy Friday. Thanks for having me.
Yes. Okay. So, for those of you who are tuning in, give us the who are you? What do you do?
My name is Jacob Holden. I'm a local born and raised Montanan from Havre, a small town about 10,000 people on the High Line. Currently living in Helena and working for Rocky Mountain Insurance Group, and I'm a health broker.
All right. So, health broker. That sounds scary to some people. What does that mean? How do you help people? How do you help clients navigate?
Health broker, health agent, assister, kind of your left-hand man.
Mm,
How I help people is looking at the details of the plan. Not all plans have the same coverages, not all plans act the same. Some plans have a co-payment or an access fee for certain services. Some plans have coverages upfront day one for prescriptions. So looking at individual needs
hmm.
for what that person may need or what that child may need and helping them navigate
Yeah.
that world is what
Mm,
I do.
yeah. I think it's just it's such a great resource because so many people, they're busy, they have jobs, they're trying to go throughout their day. The last thing they need to be is health insurance experts. Really, that's your job. And they need to rely on folks like you to help them navigate that system. So
Yeah,
what are those? Oh, go ahead.
that's a great point, Blair. Agents have to go through trainings. If
Oh,
you're certified on the marketplace, you have to go through the marketplace training. You can then attend the
hmm.
individual carrier trainings and gain that knowledge, carrier specific, go through kind of plans, etc. Become that expert of the industry, right?
Of all the players, you have to know them, and that's a big
Mhm.
deal. So key services. Yes, you help people walk through. What does that really mean? Like, what's the difference between helping an individual versus a business? Is there any differences there?
Yeah, great question. Not really. We handle, at least our agency and the way that we do business is we are a from the ground up
Hmm.
involved, and consultation is free. I think that is one thing that people don't know is there is no fee, there is no charge to use an agent for our expertise. So you never get a bill from us. We do what we call is the heavy lifting. On the individual side of things, marketplace, we take a more of an individual approach because you are looking at a family and a smaller demographic. When you move into the group clients, we still take that individual approach if the employees choose to reach out.
Hmm.
But we still, handhold is what we call it with the groups. The group leaders
Yeah.
make sure that they, understand the details and choosing plans, knowing that they can have multiple options if they want to, etc.
And something you said, I want to reiterate. It is free to use your services. And so I know for our organization, and there's something called house accounts. So some payers, so insurance companies will have house accounts where they sell directly. We try not to sell directly. We try to use brokers for all of our members because it really gives that not only third party validation, like we want you to be on the right plan. So if it's with us, great, we want you, we want everyone. But if we're not the best plan for you, we don't want you to be in a wrong fit. And that's why we rely so heavily on brokers. You know more than anybody knows about all the plans. And so I just want to reiterate that because it's such a huge deal. So I also wanted to go back to something you said earlier, which was you said something about marketplace plans. What are marketplace plans?
So marketplace plans, layman's term, is what Obamacare was. It was the
Yes.
shift of the program. Marketplace is where you screen. you or your family and dependents for advanced premium tax credits based off of where you live in the state that you're applying, how many members are in your tax household, what your income is, and who is enrolling. Those are the main points that the marketplace uses to uh, give you a tax credit if you so qualify for one.
Yeah.
Most of the plans that are available direct, like you were saying, you can buy plans direct to the carrier. A majority of them are available direct to the insurance company as well as available through the marketplace. It's just an enrollment platform
Yeah.
that is used for people to manage and enroll their plans.
Okay. Okay. And let's talk a little bit about open enrollment. What is it? Why is it important? Why should people be paying attention to it?
So open enrollment starts November 1st and goes all the way through January 15th. But it's very important that people know the deadline for changes to become effective January 1st. That deadline is actually December 15th. So
Mm,
open enrollment has just been extended in previous years to January 15th. That gives people an opportunity that kind of missed that window to still make
yeah.
changes. But it's important for people to update their application, uh, update income. You can add a spouse that wasn't on there previously. You can change your income, where you're living, address, making sure that all of your updates are done. Most importantly, it's the one time a year that you can change your plan. So if your plan didn't work well for you last year, or if you've had new services being needed that your plan
Mhm.
didn't cover very well. For example, maybe you're starting to see a counselor and you were on a high deductible plan in the previous year. You can change that plan one time per calendar year at open enrollment, and the insurance carrier has to accept that enrollment. They can't
Oh,
they can't deny you, they can't exclude pre-existing conditions. That's what the Affordable Care Act in the marketplace is built on, but you get one chance to do it, which is during open enrollment.
so it's a big time.
It is a
So,
big time, a
okay.
very busy time. Yeah.
Yeah, I'm sure you're slammed.
Yeah.
Okay, so I'm an individual. I'm saying I want to come in, whether it's to get my new plan or to revise a plan with you. What are the things I need to bring, or what are the questions I should be prepared to ask?
Income is a huge portion of the marketplace, and that's, I think, where a majority of the clients that are new to the marketplace kind of get tripped up in a sense.
Okay.
And one thing that the marketplace is kind of misconstrued is they want to know your income for the year that you're buying the insurance. So you could use the previous year's income as kind of a baseline, but you want to look forward. So come November 1st, I will be asking my clients, how much money are you going to be making in 2025
Mm,
for that entire tax year? So you're actually projecting your income, and you have to do your best estimation. So income details are a big one that people need to kind of have readily available. If you're going to do an enrollment, you need, your dates of birth, social security numbers, all of your personal information, phone number, address, that kind of stuff. Going
mm,
a little bit deeper, one thing that we do is we help clients look at prescription coverage, look at their doctor coverage. So if you want to make sure that your prescriptions or doctors are covered,
mm.
bringing that list of medications or bringing that list of doctors or specialists that you see is a good idea. So that way we can look them up and make sure they're covered.
Okay. So what what should individuals consider when comparing different health plans? And you've mentioned a few of them. What are your doctors?
Mhm.
Drugs, people can bring in their prescriptions that they're on. Anything else that they might not see if they just go to healthcare.gov or Your Health Idaho or Health Sherpa that you're able to point out as a broker to really help highlight differences in plans?
Yeah. Network is a big one.
Okay.
So you want to make sure that you are choosing a plan that has the network that you're going to use. Something that, to a point that you said, something you're not going to see on those online websites. For example, Mountain Health Co-op, you guys have value added benefits. There are reimbursements for dental. If you go get your teeth cleaned and send in a services rendered showing that you had your teeth cleaned, they will send you a check in the mail for $100. Same thing with
Yeah.
vision. You get your eyes checked, they'll send you a check in the mail for $60. Different things like that. That's not on the website. Those are things that, well, number one, brokers should know, right? If they're
Yeah.
representing carriers, but they go above and beyond just what a traditional health plan does for you.
Thank you for the plug. I appreciate that. And I
Mhm.
will just
Yeah.
add on, since you did the plug, I'm going to say those are benefits. We are member governed, so our membership dictates where any profits go and what benefits we want. So we do have, like you said, the dental vision reimbursement, hundreds of drugs offered for free at zero cost to our members, inhalers, insulins, things like that. And so I thank
That
you
free
for highlighting that.
medication, yeah, that free medication list has been pretty huge for a lot of our clients.
Mm.
And they just their expression that they are being taken care of, honestly, is has
Yeah.
been pretty cool to be a part of that and see that. So
Hmm. Thank you for saying that. Always great to hear. I am curious, do a lot of people that come in and work with you, do they end up getting a tax credit? I think there might be a misconception that insurance is, or the coverage is so expensive in the thousands of dollars. But what we're seeing is a lot of folks getting these tax credits. What are you seeing?
yeah, that on the topic of misconceptions, that is one of the biggest misconceptions that I've seen over the past 2, 3 years. Tax credits were expanded during COVID. The American Rescue Act was passed. So there used to be this cliff where people didn't qualify even if you made just slightly over the limit. We have helped so many people that didn't think they qualified for anything.
Yeah.
And they're getting hundreds of dollars of tax credits off of their premiums. And even if it's $50, $50 is at the
Yeah.
end of the day is $50. And it could be upwards. I mean, we have clients that take thousands of tax credit. It really depends on, again, how many is in your household, what your income is, who's enrolling. There is not a similar situation for
Yeah.
anyone. It really depends on your
Yeah.
individual circumstances.
That makes your job probably fun and unique, different every day.
It does, it keeps it not monotonous,
Yeah.
right? Health insurance could be very the same spiel every time. But yeah, you're exactly right. Everybody's
Yeah.
situation is different. And getting to actually help people one on one is pretty cool.
What other misconceptions, since we were talking about that, I'm just always curious what the poll says. What other misconceptions do you think people have about health insurance or even healthcare that you encounter through your everyday?
Blair, the biggest one I think is just on the income. Another one maybe would be that you can't enroll any time of the
Mm,
year. I mean, there's still people that's kind of a shell shock to. It's been around that way now for 11, 12 years. I mean, quite a while,
yeah.
but I've had people that have said, what do you mean I can't enroll? I don't have a qualifying event. So that's still out there, which goes back to the open enrollment. It's very important that you make those changes and enroll. If you don't have coverage, enrolling and doing that application during open enrollment.
Yeah. Hmm. That is just absolutely critical. And I think without that, people would, some people, not all people, would have something happen, enroll in a plan, have that coverage, and then go off of a plan, which um, in fact adds cost to everybody else's premiums, those who have conditions that need to be managed year round. And so it's important that folks pay attention to that special enrollment period if you qualify, and then open enrollment for that one-time change or to sign up.
Yeah,
Uh,
exactly.
okay, give me some six. I love good stories. Give me some success stories or even challenges if you want that you've faced while helping clients find the right health insurance coverage.
Yeah, that's great. That's a great point. I love success stories as well. One thing recently is there's been a lot of employers that have been shifting some additional cost onto the employees, whether that was for the employee themselves, mainly for spouses and dependents. Again, a recent change in the family glitch is what that was called,
Hmm.
now makes the it it gives you the ability to possibly peel your spouse and dependents off of your employer coverage to go and take a tax credit, which never used to be
Oh,
the case. So that's been a pretty big success this last,
yeah,
I'd call it 18 months, year and a half. People are learning about it. We're saving people money while still getting them health coverage and education. So that's a
yeah,
big success story, is just kind of educating the public and people on these changes. One of the bigger challenges that I've seen really is just premiums sometimes can be hard for people to look at. Even if they're looking at a bronze plan, there was a lot of people on Montana Medicaid over the course of COVID. And the last year and a half, Montana has been redetermining everybody on the program. So there's been people that have had health coverage for 4 or 5 years with no cost, and now they're having to absorb that now into
mm,
their own budget. So helping them find a plan that's going to work for them has been a little bit of difficulty because things are tight, right? It's expensive
yeah,
out there right now. And so I would say that that's probably one of the biggest challenges right now.
yeah.
Yeah.
Oh man, I love you explaining family glitch because, well, I just think you need to go on tour and do this at Congress, right? I mean, every time you ask somebody about family glitch, it's very cumbersome and complex, but the way you said it is absolutely right. And this is helping so many people. So it's a big deal. Exactly why you should go to a broker because they have digested all of these regulations and changes and can, educate people in a way that makes sense to them in their daily lives. So, okay. What advice would you give someone navigating health insurance options for the very first time in open enrollment? Any sort of best practices or advice besides going and using a broker?
I'm just going to repeat what you said, Blair. Go use a broker.
Yeah.
And there's plenty of them out there. You can go to healthcare.gov. I am not the only broker out there. Even if I was, I wouldn't be able to help every single person out there because there's a lot of them, right? But you can go to healthcare.gov and you type in your zip code, and it'll give you a list of brokers in your local area, along with how long they've been in the industry, their years of service, along with their contact info that they have listed with Center for Medicare Services, CMS. So email, phone number, some of them have their website on there, etc.
Love it. Love it. And people should do that. When we post this podcast, we will add the link for that. We've talked a little bit about how the landscape of health coverage has changed. What do you see trends coming for the future? Anything eye-opening or
Yeah, I mean, there's so many Americans, not just in Montana, right? All over the United States. There's so many Americans and people on the marketplace. I don't foresee it going anywhere, no matter what happens.
yeah,
It just is. Uh, it's a huge program. There's so many
yeah.
people on it.
And it's helped millions of people.
Hmm.
Okay. I always end with a would you rather. So are you game for a would you rather?
Yeah, let's do it, Blair.
Okay. Would you rather have the ability to see 10 minutes into the future or 150 years into the future and why?
That's a great question. I'm going to say 10 minutes into the future, solely because if I could see 150 years into the future, I don't know if I would like that outcome, if
Yeah.
I'm being honest with you. So I'd go 10 minutes into the future. I could see if my appointment was going to be late and I could reschedule it.
Oh my gosh, I was about to say the same thing. Like, I would definitely pick the 10 minutes. Like, is the line for coffee going to be super long? Am I getting coffee? Which means I could leave my house later if I knew I wasn't stopping, or You know, is the line here going to be long? Are we going to run into traffic? Are my kids going to be on time? Yeah,
Yeah, did I
definitely
forget my
10 minutes.
wallet? Did I forget my
Yeah.
wallet? Did I forget my keys? Right? You'll be able to just see that. Yeah. Yeah.
Imagine much, how efficient we would be if we could see all
So
six
much
Edmonds in
more
the back of
organized. Organized. Yeah.
Well, Jacob, thanks for being on the podcast. I appreciate you and good luck during open enrollment. And for anybody in the Helena area, make sure to give Jacob a call.
Thanks, Blair.
Have a
Appreciate
good
it.
one.